Hey everybody, I am here with Dr. Jennifer Keagle at Downtown Plastic Surgery. You can find her at drkeagle.com. So we're here to talk about cosmetic surgery and some of the treatments and procedures they provide there in her practice. So thank you very much for joining us today, doctor. I appreciate it.
Oh, my pleasure. Happy to be here.
Yeah, definitely. And I wanted to start off just by talking about how long you've been working as a plastic surgeon.
I've been a board certified plastic surgeon since 2006, and I did 10 years of training before that. So I guess I've been a doctor since 1996, but since 2006.
Okay, awesome. Was there anything in particular that, made you want to go into that field and help patients with their cosmetic goals?
Well, I love doing surgery, and I've done a full general surgery residency, but then I did plastic surgery and craniofacial surgery after that. It's a fun, it's a fun profession, and it's a lot of using your hands and creativity, which I really enjoy.
I could definitely see that. And I'm sure the artistic aspect of it was, something that is really rewarding as well.
Very rewarding, and the patients are usually happy, hopefully.
Yeah, and they're a little more excited to have the procedure done, I would imagine, than general
Correct.
surgery.
Yeah.
Cool. And then with the lockdowns and the pandemic and everything, did you guys notice a real increase in patients coming back in and getting procedures after that?
Yeah, I mean, we closed, just like everybody else did, and then once surgeries were open again, we were crazy busy. It was a lot of my patients are professional women who usually used to travel for their job, and now they don't have to.
Hmm.
And you can put your mask on and hide things as well, or if you get stuff done below your neck, nobody knows. So it was really busy and very fun.
Yeah, definitely. And I think with everybody, being on Zoom calls and everything too, and kind of just like looking at themselves all the time, they really started to see, different things they might not have noticed before.
Oh, for sure. Yeah, a
Yeah,
lot of fillers, a lot of just non-invasive stuff as well.
yeah, definitely. And what are some of the main procedures and treatments that you focus on there at your practice?
Well, being a mom myself, I do a fair amount of mommy makeovers. And being a woman in a plastic surgeon, and especially in LA, there's not a ton of us. I do a lot of breast procedures as well,
Okay.
which is also part of the mommy makeover.
Yeah. And with those procedures, are most of the people that do those just trying to recover from pregnancy, or who's the typical patient for those?
Well, a mommy makeover usually includes the tummy tuck with a little liposuction at the waist, sometimes just liposuction, but usually the tummy tuck, and some sort of breast procedure to lift and give filler breasts. So it's usually the tummy tuck part is from the stretching of the muscles and skin after having babies.
Okay. And then what can patients do to really help maximize the results that they're getting from that procedure?
I think the main thing is just listening to your doctor. I give very specific instructions, and when patients do what I ask them to do, they do really well. Going on the internet and watching other people's experience or reading other doctors, input or their protocol, it doesn't help.
Hmm. Yeah, you feel like it kind of just confuses like what you're saying versus them, and they're kind of hearing two different opinions on that.
Yeah, I think the internet is really great for certain things, but you should just listen to your doctor because in theory, we know what we're doing.
Yeah, definitely. I think beforehand it can definitely help to hear some patient experiences and maybe get an idea of the procedure. But I'd imagine after, if you're giving specific instructions, those are definitely the ones to follow.
Oh yeah, I think it's been great for patient teaching ahead of time. They know what to expect, they know what to wear. It's been really helpful, but just, listen to your doctor.
Mm. Yeah, absolutely. And obviously those are multiple procedures there. But what's the average surgical and recovery time with that?
With the mommy makeover, depending on what you get, typically, recovery means different things to different people.
Yeah.
For some people, it means how long are you going to be in pain or swollen, or the other thing is how soon can I get back to work? And the great thing with, not a great thing about the pandemic, but a great thing is that people can go back to work so much sooner, answering emails and just sitting at the computer. So mommy makeover is a little bit more recovery time than say just a breast augmentation or even just a tummy tuck itself. So I would say going back to work if you're online, probably 2 weeks after, and then no heavy lifting or exercising for 4 weeks. But we do have everybody walk right away after surgery to help prevent blood clots in the legs and kind of get you moving.
Okay. And then with the tummy tuck, is that just for like removing a little bit of excess, fat and loose skin, or what else is involved in that one?
Well, it's the loose skin, some of the fat on the skin itself, and then definitely tightening those abdominal muscles and giving you back that tight, in theory, six pack that you had before you had kids. And some people find that really gives a much flatter appearance to the belly. Some people say it gives them much more strength in their abs and helps with any back pain they had before.
Okay, so they could almost be in a better, sort of shape, than they were before.
For sure. For sure.
Okay. And then I know with the with these procedures, they've come a long way in terms of the different kind of instruments and techniques and everything that are used. Do you use anything specific to try to help maximize results and reduce the recovery time?
Well, I've done a couple of new things with my tummy tucks. Is there's a tap block, TAP. It's a specialized nerve block, and I do that at the end of the procedure, and that has really, really helped with post-op pain. And I also use a longer acting local anesthetic that works up to 36 hours, and that has helped a lot because most of the pain from tummy tucks are from tightening that abdominal muscle, and that, as you can imagine, that's pretty bad pain. So I found that patients have very minimal pain when I do that now.
Okay, yeah, that's great to hear. And who would you say is really a good candidate for those procedures, and what do you kind of need to do in terms of like managing expectations and what they're looking for?
I mean, the great thing about doing a mommy makeover is there's so many options. You can do the tummy tuck, you could do lipo, you could do kind of both.
Mhm.
And then the breast, you can do a lift or an augmentation or both as well. As far as expectations, as far as breast procedures go, I always have the patient pick out the implants with me
Mm.
and know that I'm going to get a wide range of sizes and have them bring in pictures of what they want to look like,
Mm.
and tell them if that's reasonable or not, and try and get them as close to that if possible.
Mm.
But we have a very long preoperative visit, about an hour, going over all the risks, what to expect, and kind of realistic expectations of their appearance.
Gotcha. And do you find that most patients have fairly realistic expectations and are willing to, kind of listen to you if you say, maybe this isn't, something that's achievable?
Uh, I hope so. I mean, I try and weed out patients that aren't being realistic, because that just leads to failure and sadness on all fronts.
Right.
But no, I think most patients can be realistic if you just talk to them and show them, what you can do and what you can't do.
Yeah, definitely. Yeah, and I think if you're seeing a board certified plastic surgeon, somebody who has experience, it's not just like they're saying, they can't do it specifically. They are letting what's actually possible within the realm of plastic surgery.
Yeah, I mean, I am just very blunt as a person, and
Mhm.
I'll just tell you the truth. But, I think patients appreciate that they're getting the truth, and that I'll try my best, but sometimes you can't achieve things that are unrealistic.
Yeah, absolutely. And then as far as patients like, mental and physical health, what do you typically look for, when a patient's going to undergo a surgery like that?
That's a great question. You know, I think I I think after surgeries, you have a bit of a low point in mood. So if you have underlying depression or anxiety, or even just like bipolar, any diseases that haven't been treated, I always send them ahead of time to get treated for that, because they should expect a little bit of something in the downslope.
Mhm.
Um, but I also look for red flags, mostly unrealistic expectations, all the things we're taught to look for.
Yeah, definitely. I would imagine, just being under, that amount of stress on your body can definitely have that effect on people. But I think knowing overall, like the goal of what you're gonna be able to achieve in the end is definitely, makes it worth patients still doing it.
Oh yeah, for sure. And people think plastic surgery is sometimes the stereotype or caricature of what you think it is, especially in Los Angeles, but it's really a lot of very normal, nice people trying to improve certain things about themselves. And
Yeah,
it's not all vanity, sometimes it's functional as well.
yeah, absolutely. And I think there's a lot of that stigma, thankfully, has been, going away in the recent years. And, patients aren't, feeling like they have to hide what they've had done so much.
I would agree. I would agree.
Yeah. And lastly, what would be your advice for a patient that's been thinking about getting that done and is not really sure kind of their first steps and how they can educate themselves on the procedures?
Well, like you very smartly pointed out, always go to a board certified plastic surgeon, especially where I live. Everybody says they're a plastic surgeon, but being a board certified plastic surgeon takes a lot of training. It takes board certification and a specific training in plastic surgery. There are people who focus on cosmetic surgery, which is that is a part of plastic surgery, but there are cosmetic surgeons who are not board certified plastic surgeons. So please look for that. And they should be a member of the American Society of Plastic Surgeons or the Aesthetic Society, and they should put it on their website. And you can always call their office and ask.
Yeah, absolutely. And what would be the best way for patients to get in contact with you?
Any way is possible. Call. There's a way to get through on the website, Instagram, Facebook Messenger, carrier pigeon, however.
All right, perfect. Yeah, well, those are the questions I had for you. So I really appreciate you taking the time to talk with us and share the information. That was great.
Oh, my pleasure. Thank you so much.
Yeah, of course. Have a great rest of your day. I appreciate it.
You too.
Thanks.